And I'm using that number because we know from simulations that that's the number if you had a Spanish flu today, with all the modern medicine that is in place. We spent the last at least 10 years trying to evangelize governments to get their act together into creating an international pandemic preparation capability. And then we had Ebola, and it was completely blundered, and 10,000 people plus died as a result of that. We were lucky because Ebola is a gentle and kind disease in comparison to some of the diseases that could really drive a pandemic. We thought we had learned a bunch of lessons, nice reports from the WHO, and then we had Zika, and we're blundering it all over, okay? So finally, the private sector, starting with the pharmaceutical companies, starting with people like Bill Gates, in Davos last week, announced the formation of the Coalition for Epidemic Preparedness. And guess what? It was private and it was public. The government of Germany, the government of Denmark, the government of Norway, and the government of India teamed up with Bill Gates and a whole slew of private sector participants. And a $500 million fund was created overnight to begin funding the innovation that is necessary for global participation. This wasn't policy, it's a Ministry of Health. Yes, there's government as a role. By the way, if you look at the money, the private sector is putting up 2/3. What actually the government are putting up is just a little bit. And that little bit is important because it provides the infrastructure, the framework, the policies to allow what is essentially a private sector driven initiative to thrive.